Hello and welcome to my presentation on Unit 8, Roles and Responsibilities of a Registered Nurse. My name is Joyce Asiedo. In this presentation, I'll be discussing the recent changes and their impact on the roles and responsibilities of a registered nurse, discussing the role of the Nursing and Midwifery Council in relation to nursing practice, analyzing the implications of the code on the nursing practice and the role of a registered nurse, explaining the need for the effective communication in multidisciplinary healthcare setting, evaluation of the effectiveness of the multidisciplinary approach in a healthcare setting. What is a registered nurse? The Royal College of Nursing defined nursing as the use of clinical judgments, and the provision of care to enable people to promote, improve, maintain, recover health, or when death is inevitable, to die peacefully. There have been many changes in the healthcare over the years, and it had impact on the duties and responsibilities of a nurse. Nurses today are constantly making decisions, gathering data, making medical assessment, and prescribing drugs. This has changed the profile of a nursing as a career. These changes were triggered by political, economic, social, technological, organizational professionalism, and policy. Political change. The NHS and the Community Care Act 1990 gave nurses more responsibility for business procedures and budgets, including management. The Patients Charter introduced in the 1990s gave patients the right to a named qualified nurse, midwife, or health visitor responsible for their nursing care. This made nursing profession more accountable for their job and enabled them to train properly to become efficient and competent in their roles. Between 1992 and 1999, the Department of Health reviewed policies which led to nurses being given rights to prescribe medication for minor illnesses and injuries in health promotion and palliative care roles. The introduction of Project 2000 changed nursing from a vocation to a profession and placed emphasis on the wider aspects of health education. Also, the Modernization Agency, which was founded in 2001 to redesign and expand the skills of the roles of all healthcare professionals, where nurses would be assessed on their honesty, competency, ability to solve problems, and coordinate care. Economic changes. The funds and other resources made available to the healthcare sector are determined by the amount of money contributed by the public, mostly through taxation. Fall in budget impacts economic changes through inflation, rising cost of living, and lower or no percentage increase in salary. For instance, in 2011, the government's imposition of a 1% cap on NHS pay rise led to a negative impact on nurses' retention and recruitment. With the growing of older population in the country, there was the need for more people to care for them. This has contributed to an increase in demand of nurses and other healthcare professionals, implying more formal educative training and increases in cost. Social changes. Medical research, nursing science, and advancement in technology have promoted longer, healthier lives and fewer and more treatable illness, as well as increase in the cost of living. Long-term care and chronic illness are becoming more common. This has made the role of a registered nurse challenging, as the NHS need to facilitate more training on the jobs, so they are equipped and updated with all necessary information to deliver appropriate service and treatment to patients. Nurses are also trained to manage patients in the community to keep them away from the hospital, to reduce costs, ease space, and make beds available for serious illness. Technological changes. The continuous advancement in technologies is having an impact on how nurses perform their daily duties and responsibilities. Nurses now make use of wireless device, special call system, easy access to patient record, as well as monitoring devices to track the progress of patients' recovery. It has also created new nursing specialties and roles. Some of these specialties include telemedicine, nursing, and nursing informatics, where specialties have grown over the years. Organizational professionalism and policy. In addition to the role of the Nursing and Midwifery Council, the Clinical Commissioning Group (CCG) were introduced after the Francis Report, which advocated that stronger leadership and open communication system would create safer health care environments and improve the quality of care of patients. This meant nurses would need to carry out risk assessment and adhere to safety policies as part of their role. Specialties Expertise has been developed in response to the changing needs of patients and the general population, as well as innovations in healthcare policies and provisions. These roles were created to increase efficiency, support career progression, reduce waiting times, and improve patient outcome. Role of Nursing and Midwifery Council, NMC. The Nursing and Midwifery Council is a regulatory body for nurses and midwives in England. It was established in 2001 under the Nursing and Midwifery Order established by Parliament. The aim of NMC is to maintain a register of nurses, midwives, and health visitors through setting and monitoring standards of education, practice, and conduct, as well as handling complaints about misconduct and unfitness to practice of those on the register. The vision of NMC is to ensure safe, effective, kind nursing and midwifery that improves everyone's health and well-being. The rules implied by the NMC was that a registered nurse must be qualified at least in one of the four fields of nurses, those being adult nursing, pediatric nursing, learning disabilities, and mental health. NMC Standards of Pre-Registration Nursing Education 2010 was introduced to prepare nurses to take a range of roles, including leadership positions. To qualify to be entered into NMC register, newly qualified nurses must meet NMC eligibility requirements criteria to take the test of competence. Once confirmation of eligibility is received, applicant must register and pay to take the test with Pearson VUE. Since April 2006, the registered nurses have been required to confirm they are fit to practice by renewing their registration every 3 years, and it is their own responsibility to do so. High standards must be met to revalidate their place on the register, including 450 practice hours, 35 hours of CPD, 5 pieces of practice-related feedback, 5 written reflective accounts, a reflective discussion with NMC registrant, a health and character declaration, appropriate professional indemnity insurance arrangements, and confirmation that all requirements are met. The NMC regularly publishes guides to ensure all registrants are kept up to date with the changes and are reminded of their commitment to the NMC code. The NMC codes. The codes are the profession standard that nurses and midwives and nursing associates must uphold to be registered to practice in the UK. The code, originally created in 1950 and revised in 2015, exists to hold NMC registered nurses, midwives, and nursing associates accountable for their actions, particularly when they fall short of their professional standards. The code is written in law. Occurrences of poor staffing, unprofessional attitudes, or limited resources are examples of circumstances where professional working could be compromised. These should be raised as a concern to the employer, the professional body, or the union. The objective of the code is to safeguard the health and well-being of the public by ensuring provision of high standards of care to practice the clients. The codes are organized under 4 domains. They are prioritize people, practice effectively, preserve safety, promote professionalism, and trust. Prioritize people. This requires that nurses uphold people's dignity and respect, irrespective of their gender, race, sexuality, religion, and treats them as individuals. The registered nurse always acts in the best interest of the people, as well as respect patient right to privacy and confidentiality. Practice effectively. This requires nurses to act in accordance with the best available evidence, such as ability to interpret results and use this to communicate decisions which will be accountable for, and to use it to delegate tasks and duties to the other members within the setting which they work, as this will result in better patient outcome. Preserve safety. This requires registered nurses to reorganize and work within the limits of competence, which requires a practitioner to recognize and work within one's limits of competence and practice the duty of candor, raising concerns with vulnerable patients, as well as prevention of potential harm to keep everyone under your care safe. Promoting professionalism and trust. Promoting professionalism and trust. This is ensured by nurses always maintaining and defending the reputation of nursing and midwifery, fulfilling all registration requirements, adhering to the legalities of the settings within which they are working. This also includes cooperation of all investigation and audits to ensure the nurses' compliance. Analysis of the implications of the code on nursing practice and the role of the registered nurse. The NMC monitor the professional standards of practitioners through professional standards team. They provide clinical and managerial leadership for clinical professionals to achieve high professional standard and to provide framework to enable action to be taken to protect patients and members of the public. Action is taken if registered nurses fail to uphold the code. This can be disciplinary actions by the regulatory body, which includes striking off where a registered name is removed from the register and are not allowed to work in the UK or prosecuted. The need of effective communication in a multidisciplinary team healthcare setting. Multidisciplinary team. What is a multidisciplinary team? So multidisciplinary team is a healthcare setting comprises of a patient and different healthcare professionals such as doctors, nurses, social workers, psychologists, occupational therapists, and psychiatrists. These professionals come together they are all specialized in a specific field of practice and work together to make decisions regarding the treatment of patients. It covers primary, secondary, community, social care, and mental health services. The need of effective communication in a multidisciplinary team. Effective communication in a multidisciplinary setting is essential for timely and effective operations. Effective communication works simultaneously with the patient, where healthcare professional and the patient both have the power to decide. Team can come up with alternative treatment plan in the end. Both patient and care provider are satisfied as patient feels power is being given to them for their choice. It helps the healthcare administrators and healthcare practitioners to share information ethically to protect patients' confidentiality. Also, healthcare professionals can help patients feel at ease and encourage them to disclose relevant information. Consequently, effective communication builds positive work culture where health professionals share and understand the values of healthcare organizations. A multidisciplinary approach is effective when teams collaborate the expertise and skills of different healthcare professionals to assess, plan, and manage care jointly to achieve the best outcomes for patients' treatment. Establishing clear and effective channels of communication is important. To achieve good integrated care, nurses must have good collaborative team behind them, supporting them with shared goals, communication of professional knowledge, and to encourage one another to find optimal solution to patients' health problems. Teamwork being a priority enables professionals and nurses to collaborate by conferring through honest, reliable, and confident sources to make decisions clearly and effectively. The roles of the nurses include being able to deliver the right care successfully and productively, and the right attitude and the right information gained through active listening in multidisciplinary healthcare settings. Nurses must abide by specific rules, policies, and procedures by using multiplicity of tools and skills gained through meetings and independent learning sessions. Having overcome communication barriers is important and crucial to manage patients' needs. Evaluation of effective communication in a multidisciplinary team healthcare setting. Successful nursing process depends on the quality of relationship built between nurse and the patient. Effective communication among staff encourage effective teamwork and promotes continuity and clarity within the patient care team. Good communication encourages collaborative practice, clear communication, clear definition of roles and responsibility, clear goals and objectives and strategies, recognition and respect for team, and competent leadership. Nurses work closely with patients and healthcare professionals in the MDT, and every member within the team understand their role, responsibilities, and accountability, where the nurses serve as an advocate for the patient in their care. So limitations of a multidisciplinary care setting includes lack of critical information, misinterpretation of information, unclear orders over the phone, overlooked changes in status. Advantages and disadvantages of multidisciplinary approach in a healthcare settings. The most important advantage of multidisciplinary approach is that each individual patient get the most appropriate treatment decision made by a team of experts and support for more complex cases. Also, MDT approach helps to improve services coordination in the sense that these services are coordinated together, and uniformity is provided to patient that improves treatment delivery. And although teams might not always be together, communication that happens makes services coordination easier. Another advantage of MDT approach is continuous team improvement. The MDT approach relies on experts of different disciplines to share knowledge, thereby enhancing a professional scope and depth of learning. Lastly, it expedites the referral process as the team comprises of different specialists. When a patient needs to be referred for a specific treatment, the patient already has access who will communicate, work together to get the process approved, reduce delays, and allow the patient the best possible chance to improve their health. Although professionals acknowledge the value of MDTs, there are several barriers that prevent the full realization of the benefits. Firstly, learning to work with different types of health professionals in an MDT can be difficult due to time constraints. Teamwork can be time consuming, especially when meetings and audits must be conducted. These health professionals must dedicate their working hours to some of these meetings, which can be difficult in a BEV health organization. Also, shortage of staff and resources also prevent collaborative work, which is required in a multidisciplinary approach. Staffing shortages, particularly in nursing practitioners, can pose a huge challenge to the team, placing more pressures on other members of the multidisciplinary team. Lastly, an individual level on MDT success also depends on similarity in practitioners' background and educational experience. The reality of a modernized team is that it involves a wide mix of people, some just starting their careers as health professionals, while some beginning to reach the finish line in their careers. Thank you.